On September 3, 2026, the revised NHS Community Pharmacy Hypertension Case Finding Service Specification goes live. The update introduces mandatory changes across three main areas: patient eligibility, clinical delivery protocols, and compliance operations. Pharmacies must adapt their workflows immediately. Failing to follow these new rules will result in unpaid consultations and strict compliance penalties during post-payment verification. This document details the updated exclusion criteria. Notably, patients checked via this service in the last 5 years are excluded. Routine repeat checks are out of scope. If exceptional clinical cases warrant a repeat check, explicit clinical justification must be recorded for post-payment verification. General practices are now restricted to signposting adults 40 and over without a prior hypertension diagnosis. These strict eligibility rules require pharmacy staff to rigorously vet a patient's medical history and previous screening dates at the counter before taking any clinical action. In the updated ABPM guidelines, the calculation for a valid average now requires at least 14 waking day measurements. If staff fit a monitor in the afternoon, patients must continue wearing the device into the next day to capture sufficient waking hours. During clinic checks, pulse rate data now has explicit escalation thresholds. If a patient has coexisting symptoms and a pulse rate below 50 beats per minute or above 110, you must consider an immediate general practice referral, even if blood pressure is normal. If a patient misses their ABPM appointment, pharmacies are required to make at least 2 separate contact attempts to reschedule. If the appointment cannot be rearranged within 7 days, you must notify the patient's general practice team on or after the 7th day. These exact data minimums and escalation thresholds shift the pharmacy's role to highly structured diagnostic data collection. This specification section outlines the new operational limits for off-site service provision. Pharmacies are strictly capped at a maximum of 4 off-site clinic days per financial year. You must secure prior approval from your integrated care board using the Annex F request form. To gain this approval, owners must submit documented risk assessments detailing patient safety measures and the impact on wider pharmacy services. Furthermore, any off-site clinic must be directly supervised by a pharmacist or pharmacy technician present at the location. Under the withdrawal clause shown here, contractors who deregister from the hypertension service face a strict penalty. You will be locked out and unable to re-register to provide the service for a full 4 months from the date of deregistration. Ad hoc off-site clinics are no longer legally compliant. Every external event now requires documented administrative planning and explicit authorization. Pharmacy managers need to update their standard operating procedures to reflect these clinical escalation pathways. Most importantly, frontline staff must be trained to enforce the 5-year triage rule for walk-in patients to eliminate out-of-scope screening. Full compliance with the finalized NHS England specification is required by the September 3rd deadline. Ensure your systems, staff, and documentation are ready.